in the field of health. According to latest statistics in Switzerland, doctors only receive 7% of Switzerland's total healthcare cost in the form of their salaries. So how is the remaining 93% spent? The centralisation of all financial flows related to the health sector in Switzerland in the hands of the state through social security or in the hands of the mandatory health insurers has resulted in the tenfold multiplication of healthcare costs in Switzerland over the last 4 decades. This aberration is made possible by the absence of people's third-party oversight of the financial flows linking all the sectors in the field of medicine, namely the health insurers, the pharmaceutical companies, the state, regulatory bodies, and doctors themselves. Doctors have allowed themselves to be overwhelmed by all these service providers, in inverted commas, who impose treatment protocols upon them, who impose legally required administrative processes upon them, and who impose procedures for checks and compulsory further education programs on subjects and knowledge that they already possess. Once people third-party oversight of all financial flows related to the field of medicine and, more broadly, related to the health sector is required by the Constitution as described in the publication 2024 by Pascal Borel, we will immediately see with absolute clarity who exactly benefits from this monstrous explosion in healthcare costs. Once people's third-party oversight is imposed, we will prevent financiers from taking control of healthcare. Once people's third-party oversight becomes the norm, all actors in healthcare will be held fully accountable in their respective roles. Doctors will once again be masters of medicine, free from financial constraints. State insurers and Big Pharma will no longer be able to conceal the colossal profits they afford themselves on the back of people who are losing their most precious asset, their health. Had people's third-party oversight of all monetary flows in the field of health been the norm, its takeover by financial interests would have been impossible.